George W. Bush introduced privatization of Medicare with Medicare Advantage in 2005. Now about a third of people on Medicare, between a quarter and a third, have opted for these privatized programs that will screw them if they get seriously ill or when they get seriously ill. And now it's expanding. Check out what Alex Lawson had to say about this. This is Trump's new plan to save Medicare. Right after this, be sure to leave your comments, ding the bell, subscribe to our channel, and share it with your friends. On the line with us right now, though, is our old buddy Alex Lawson, the Executive Director of Social Security Works, owner, host, producer at We Act Radio in Washington, D.C., SocialSecurityWorks.org, also a frequent fill-in guest for me on this program, person that we love and appreciate. ALaw202 is his Twitter handle. Alex, welcome back.
Thanks for having me, Tom.
So Donald Trump announced a couple days ago, and I don't think this got anywhere near enough publicity, that he was going to save Social Security, right, just in time for, save Medicare, just in time for Medicare for All to roll out. What's really going on here?
This is nothing except for Donald Trump's plan to privatize Medicare. And you are absolutely correct that with everything else going on, it barely caused a blip. But what Donald Trump is proposing is basically the exact same thing that Paul Ryan had been trying to accomplish for decades, for years and years in the House, in the Congress. So it's a real threat. And the difference is obviously that he's going to be doing most of the stuff through executive action and not through legislative changes. So it's not as permanent. But, what we know is when you break a program through executive action, it is oftentimes not possible to put it back together. And that's what he's proposing. He dresses it up in some language. He says, he's going to bring some market pricing into traditional Medicare. But this is what he's doing. He's privatizing Medicare. He wants to turn our earned benefits over to his criminal friends in the insurance industry.
And they're doing this through these privatized programs that when the Bush administration pushed this through, correct me if I'm wrong, I think the year was 2005, Medicare Part C, when they first laid this thing out, that private health insurance companies can offer insurance to people over 65 and the government will backstop them and subsidize them. They called it Medicare Advantage, which is a tragedy because it's not Medicare, it's private health insurance. I got my Medicare booklet that had the state of Oregon, all the policies that are available, all the Medicare Advantage policies, and they have annual deductibles of $3,000, $5,000, $10,000, $20,000. I mean, if you get seriously sick and you've got Medicare Advantage, you may be in a whole world of hurt. Whereas if you've got regular Medicare and a good solid Medigap policy to fill in the holes, you're doing good. But this is they're trying to expand the number of things that can be offered on the front end, the fancy, the sizzle stuff, selling the sizzle rather than the steak, whereas the steak is getting smaller and smaller, the Medicare Advantage plans and what they, will pay and where their exceptions are and how they can cut you off and drill holes into your policy. Do I have that right, Alex?
That's exactly right, Tom. It's complicated on purpose, but what you just said is exactly right. What they're always trying to do is allow the private insurers to offer more bells and whistles, but actually to try to deny the care, the actual costly care that people think they're getting because they think that they're on Medicare, but it turns out that Medicare Advantage is actually private insurance. So there are denials. And what the reports, the Inspector General reports, the IG reports have shown is that it's wrongful denials because we know that's what private insurers do. They take our premiums and deny our care. And
that's
what
their
Medicare
business
Advantage
model.
does is exactly. It's the only way they can make money. And what Medicare Advantage does is brings that into traditional Medicare. Now, what this executive order does is even more nefarious than just, they've been trying to steer people into Medicare Advantage, the whole administration. But what they're talking about now is actually breaking up traditional Medicare. So not just making Medicare Advantage more attractive to people, they are going to do that, but actually breaking up traditional Medicare to make it less
How?
attractive to people.
How specifically?
So when they say they're bringing these market pricing and or other terminology like that, what they're talking about is replacing the Medicare fee-for-service with, something that is more like private insurance, which just fundamentally changes and destroys the way that Medicare functions. And that's what this executive order.
So
was
forgive me, Alex, I'm not as deep in the weeds on this stuff as you are, and you really know what you're talking about, and I really don't. I mean, I have broad understanding, but it sounds to me like what you're saying is that right now Medicare has basically a table of here's what we pay if you have gallbladder surgery, or here's what we pay if you're going in for to have a wart removed, or whatever it may be. Here's what we pay to have blood pressure regulated, and they can afford to pay that because they've got a budget. They know how much money they've got coming in, and this way they get to know how much money they've got going out, and they do the whole actuarial thing, and that's how Medicare stays solvent. And what Trump is coming in doing is saying, screw all that stuff. Your payment schedule, we're going to throw it out the window. We're going to make it subject to the whims of the monopolies in the hospital industry and the drug industry, and in some of the medical specialties. And Medicare is going to end up having to pay a whole lot more in a whole bunch of areas, and as a consequence, it's going to get broken. Is that what you're saying?
As usual, Tom, you are deeper in the weeds than even I, and can explain it way better. That's exactly right. What I think people should just picture is, all the times that we've been sold this, the mythical magic of the marketplace, right? Like we have a public utility and it's working fine, and then somebody gets paid off in government, and all of a sudden they privatize it, and they promise us that it's going to deliver savings because of competition and the magic of the marketplace, right. And then they're going to pass those savings on to the consumers, and that never happens.
Right, and then you discover it's Enron. Yes.
Exactly. What happens is we get less and we pay more, and in the end, oftentimes it goes bust and we get nothing. Yeah. But some Wall Street bankers end up getting another yacht. Yeah. And that is what this executive order is aiming at. Now, I want to say this, Tom. We're not actually sure, like many of the things that Donald Trump says, we're not actually sure what authority he has for some of the things he said. And there are legal restrictions on Medicare Advantage. We've worked to ensure that Medicare Advantage has to provide certain things, right? Like, so they can't do all bells and whistle and no cancer care. But the way he was talking about it seemed like he was saying he was going to somehow circumvent that. And there's a lot of
So now, he in other words, he blew up, the way that he blew up, or probably the major hole that he's drilling in the Affordable Care Act, Obamacare, is allowing insurance companies to offer junk policies where, $150 a month and you think you've got health insurance, but in fact it doesn't cover anything more than $3,000 in the hospital in any 1 year or whatever. So it sounds like what you're saying is that with Medicare Advantage, he wants to introduce junk policies into the Medicare Advantage market too.
He wants to introduce he wants to basically just let the insurers do whatever they want, and right. He wants to kneecap Medicare, which is, right, that's what
sure.
they do over and over and over.
They've been trying to do it since Ronald Reagan said it was socialism, and warned us about someday we'll look back and remember when men were free before Medicare, right? So, Alex, we just have a minute or so before we're going to hit a hard break here. John Larson's Social Security 2100 Act is moving in the House. NAFTA 2.0. The big problem with NAFTA 2.0 that I'm hearing from a bunch of people actually is that it's a giant sweet kiss on the lips to the drug companies. Tell us about these things.
That's right. We got to get all of the pharmaceutical provisions out of NAFTA 2.0. Everyone should be calling their members in the House and demanding that's the ask. Pharma has no place in NAFTA 2.0. With the Social Security expansion, the 2100, we're coming up on this is the last chance we have for the markup in Ways and Means. We think we're going to get it, but we need people to be demanding of their members in the House that we, if they're Democrats, that we get a markup of the 2100 Act in the Ways and Means
So
Committee.
presumably this is to stabilize Social Security so it'll be solid and solvent at least until the year 2100. And I'm guessing that has to do with lifting the cap?
It does, and it's actually not just, it does make it solvent, what they actuarially call sustainable solvency, into 2100, past 2100, but it also expands benefits. So it changes the COLA to more accurately reflect the cost increases faced by seniors, people with disabilities, and it increases benefits across the board. So it's a Social Security expansion bill, wildly popular, and we're just about there at the finish line in the House. We just need that extra push from the people.